Assalamu alaikum ji, and welcome everybody to our fireside chat session for today. हमें आज join कर रहे हैं Dr. Umar Chughtai of Chughtai Labs. Thank you, Umar, and welcome to our session for today. Really glad to have you over. Like always, हम आज का session begin करेंगे with a quick brief about what Noor International University is, and then I will come back and introduce formally Dr. Umar Chughtai. So over to the team for playing the NIU video. Thank you. All right. Thank you very much again, Umar, for joining us today. मैं एक quick तारुफ करा दूं Dr. Umar Chughtai का, who's our guest for today. Dr. Umar Chughtai is the Director of Operations at Chughtai Labs. He is a graduate of King Edward Medical College, KEMC, and he did a residency and fellowship training in pathology in Texas, and returned to Pakistan in 2007 to join Chughtai Healthcare. He is also the Vice President of the Histopathology and Cytology Society of Pakistan, and is a member of the Entrepreneurs Organization, EO, and the Young Presidents Organization, YPO. He is a board certified in anatomic and clinical pathology. He helps lead Chughtai Lab to the forefront of diagnostics in Pakistan, and his special interests are in leadership, transformation, operational excellence, and customer experience. Umar, thank you again. आपने हमें अपना कीमती टाइम दिया. At Noor International University NIU हम medical lab technology पे पढ़ाते हैं. So I think आपका यहाँ आज होना amongst other things इस स्पेशलिटी की वजह से बहुत ज़रूरी है और बहुत I hope कि engaging experience होगा. We are joined today by not only our current students but also हमारे alumni, हमारे prospective students, and also some faculty members. तो over to you, Umar, थोड़ा सा बताइए अपने बारे में, about yourself as a person, about Chughtai Lab, and then हम इंशाल्लाह थोड़ा सा एक Q&A session करेंगे, and as usual हम 45 minutes, so in about 40 minutes from now we'll be wrapping up the session. So over to you.
Bismillahirrahmanirrahim. Assalamu alaikum, Salim. Thank you so much for having me. First of all, I'm very impressed by the intro video, and I must confess I had no idea that mashallah, Noor International University has grown so much and is offering such a wide array of programs. It's impressive. I will take an opportunity sometime down the road to come and visit. Also, I would love to see, बहुत खुशी होती है जब पाकिस्तान में अच्छी चीजें हो रही होती हैं, and it's very nice to see कितने programs offer हो रहे हैं, because all of those things are needs of the hour for our economy, for our country. And like you said, you have a medical lab technology program, and you have the medical college, and all of those are important contributions to our country. As far as myself, I was born and raised in Lahore, and I went to HSN College, then Government College for FSC, then King Edward Medical College. Then, like you mentioned, I US चला गया था residency or fellowship के लिए. My father is incidentally a pathologist, and he founded Chughtai Lab in 1983. तो मैं हमेशा उनके साथ काम करना चाहता था. I always used to visit and work as a intern, as an observer, whenever I had an opportunity. So when I became a doctor, I said, "Ji, now I can become a pathologist and I can work with you." And he said, कि अगर pathologist बनना है तो कहीं ऐसी जगह जाके pathologist बनो जहाँ पे कोई मुझे ना जानता हो, so that you know and everybody else knows that you're a pathologist in your own standing, not because I'm a pathologist. So इसीलिए then 4 days after my medical college result, final year result, I found myself in the US, उधर की exams की तैयारी करने के लिए. So it took a few years, but I came back in 2007, and I'm living my dream. I'm working with my father, and we're working towards hopefully improving healthcare in Pakistan in multiple sectors, multiple services. तो यही हो रहा है जिस दिन से वापस आए में लगे हुए हैं.
No, which is great, mashallah, and thank you for your candor. आपने जो ये introduction में भी बताया, mashallah, आपके वालिद साहब भी Dr. Sohail Chugtai साहब is of course very well known in his field. और उन्होंने mashallah एक organization शुरू की, which आपने इसको take up किया, और इसको जो हमने देखा in the last few years बहुत mashallah expansion भी हुई है under your leadership. So kudos to you again. जिस तरह आपने कहा कि हमारी जो मेडिकल साइड पे जो रेल्म है 200 मिलियन की आबादी इज नो जोक आई थिंक इन पाकिस्तान, और हमारा जो हेल्थ केयर का सोशल नेट इज वेरी वेरी लिमिटेड. कोई यहाँ बीमार हो जाए तो उसको इट कैन बी डिजास्ट्रस नॉट ओनली फॉर द पर्सन in question but for his or her family, because livelihood is then dependent on that person. So extra care needed. Mashallah, what we see Chugtai today, of course, today in this day and age in particular, of course, जो हमारे साथ ये COVID का, that has been I think something which has thrown a lot of challenges at people. और आपका जो particular इदारा है उसने of course has been at the forefront of providing services for testing and being a very active part of the government for supporting this whole element during the pandemic. तो उमर Q&A में launch करते हैं अगर आप इजाजत दें. PCR टेस्टिंग के बारे में, ऑफ कोर्स ये एक बहुत हॉट टॉपिक बन चुका है. तो कैन यू गाइड अस अ लिटिल बिट मोर? आई थिंक अगेन आप लोग वर एट द फोरफ्रंट ऑफ इनफैक्ट PCR टेस्टिंग इन द प्राइवेट सेक्टर इन पर्टिकुलर. थोड़ा सा उसके बारे में बताइए कि कहाँ से आप शुरू हुए, आपके जहन में क्या था, इसका स्केल कहाँ तक जाएगा, हैज दैट स्केल बीन अचीव्ड, उसमें क्या चैलेंजेस आते हैं, and any special steps that you've taken to help address those challenges that you've faced in this particular area?
Yeah, a very good question. I'm very happy you asked this question. So first of all, let's understand PCR test though, PCR test has been around for 20 years, and हम 20 साल से कर रहे हैं PCR test. इससे कोविड से पहले सबसे कॉमनली वो हेपेटाइटिस बी, हेपेटाइटिस सी और HIV के लिए होता था, बट यू कैन यूज द टेक्नोलॉजी फॉर एनीथिंग. पाकिस्तान में there are no more than a handful of virologists. There are only like 10 or 12 virologists in the country, people who specialize in virology, and it's a special field. FCPS से recognized है. It is clearly a need of the moment, आप देख सकते हैं. But at Chugtai Lab, we also have Chugtai Institute of Pathology, and we started residency training in virology in 2015. And Professor Waheed-ur-Zaman, who was one of the few foreign qualified virologists in the country, we had him. He actually started the virology department at the Armed Forces Institute of Pathology in Rawalpindi, which is incidentally the only other place जहाँ पे virology की FCPS training हो रही है पाकिस्तान में. So there's only 2 places that are making FCPS virologists in the country. We are one, and the army is the other place. And so Waheed Saab joined us in 2015-16, and then so we started a residency program, and our residency program was fairly mature by the time COVID came around. So we had some insight into what's going to come next, because our professor of virology had dealt while working with the UN with Ebola outbreak in Africa, and the SARS outbreak, the first SARS outbreak. So जब ये चाइना में पहली दफा कोविड की बात हुई, it was not called COVID back then. तो we had some inkling के this thing might spill over. And if you remember, उसके बाद फिर initially ये UK में और US में cases आना शुरू हुए, Seattle में cases आना शुरू हुए. So once that started happening, which was I think January, that's when I remember Professor Wahid and myself going to Dr. Chuktai and saying, we need to start COVID testing. We need to have the ability to do COVID testing. And he said, well, what are you asking me for? Go ahead and do it. So because उस वक्त there was so much that was not known. Okay, how contagious is it? How hazardous is it for the healthcare workers जो ये test करेंगे? In fact, I remember having conversations with lab directors at other places, and many people were reluctant to start the test because we have a huge responsibility towards our own team's well-being and safety. And so, but at the same time, we realized, and this is something that we have come across many times in the past, कि अगर हम नहीं करेंगे तो फिर कौन करेगा? So we kind of took the plunge. We ordered the test kits that were needed at the time. And we started offering the test. I think it was around maybe the 20th or 21st of February 2020. So like 50, 60 days after it had been described, we started offering the test. Of course, nobody had any idea कि इसका scale क्या होगा, and nobody had any idea how quickly that scale would be required. So of course, it required a lot of logistical efforts. It required a lot of scaling up very quickly. But you know, it was there's this movie Interstellar. उसके अंदर you know, they get into this very precarious situation. तो उसके अंदर वो कहता है, this is impossible. तो कहता है, but it's necessary. So it's one of those things. It was necessary. We had to do it because you know people were scared. And then so we developed it and we scaled up, and we diagnosed the first few cases in Lahore, and then after that, you know, it just kept building. I don't think anybody had any idea going into this, just how momentous a task this would become and how difficult it would become. Because like I said, the testing and the logistics around the testing is one thing. It's the PPE requirement, the training of PPE agar aapke paas available bhi ho, is your team trained enough to handle the samples and to use the PPE properly? And on top of that, no PPE is perfect. And what happens when somebody gets infected? So I think in April last year, we ended up setting up our own ICU for our own team. And so on day one, it was empty. And for several days, it was empty. It had like 20 ventilators. And we had converted one of our medical centers into our own inpatient facility. We actually had it registered as a hospital with the Healthcare Commission. And the idea really was so that everybody could tell, सारी team को मालूम था कि अगर हमें कुछ होगा तो हमें अकेला नहीं छोड़ा जाएगा. And that was very important. And it ended up being used significantly, and there was a time when it was full. And not just with team members, but also team members' families and parents-in-law, but you know, and children. And but thankfully, we were able to take care of our people. We lost some people, but mostly it has been a successful exercise in taking care of our people. And you know, I think it was our responsibility to do that. We would not have been able to do what we did, to serve as many patients as we did, if we had not had that. अगर वो capability exist ना करती और हमारी टीम को नजर ना आता कि वो capability exist करती है कि हमारी अपनी ambulance आके लेके जाएगी, अपनी care में होंगे, everything will be taken care of. So that was very important, and I think that is one of the hidden keys जिसकी कोई कभी बात नहीं करता, कभी वो spotlight नहीं होती वो बात. But I think in any challenge, अगर आप अपनी टीम का ख्याल रख लें तो फिर बाकी चीजें आसान होनी शुरू हो जाती हैं. So I think that was one of the significant keys for us.
And thank you, Umar. Again, thank you for your candor. जो आपने ये आखिरी वाली, well, पहली वाली बात की कि yes, you're right कि of course PCR testing as a methodology बहुत अरसे से बहुत पुरानी है. Hepatitis की, in fact, interestingly, I had a personal experience with hepatitis some time ago during the COVID period. So कुछ a certain variant, and that was interestingly also PCR test. Nonetheless, जो आपने अभी more recently बात की that staff and team की well-being, of course, was going to be our next question, क्योंकि आप लोग ना सिर्फ forefront पे थे in testing, but because of the exposure, because of the contagion of this particular disease, उसका जो उसके risks जो थे, I think आपने it seems कि बड़े अच्छे तरह अपनी टीम को उनकी physical well-being की तरफ and more importantly mental well-being की तरफ focus किया. So we got to actually interact quite a bunch with your team at Fatma Memorial also, which was great. I think हमारा बहुत अच्छा experience हुआ और आपकी team was very positive on the whole for performing their services as frontline workers, you could say. So it's refreshing to see, mashallah, as a Pakistani organization, you took the bull by the horns and moved forward. So that was going to be another question ke aapne staff ko kis tarah handle kiya. We can move on to a slight, aap keh sakte hain, contentious question early on into the session. PCR test, as we understand, uski efficacy, uski reliability is at least amongst other tests one of the higher rated efficacy and reliability. Rapid testing options bhi available hain, which are of course less reliable, lekin they are cheaper. And आपके क्या comment होंगे इसके बारे में कि इस trade off of reliability versus cost, and it seems कि अभी भी Pakistan government की without kind of challenging any norms per se or without treading on any toes, what would your comment be इसके बारे में about reliability versus cost factor, and जो it seems कि government ने एक decision दिया कि हमने promote नहीं करना, आप इसके बारे में?
मेरी आज earlier किसी से बात हो रही थी about a completely unrelated topic, and मैं उनको कह रहा था कि कोविड ने हमें एक चीज सिखाई है कि, and we have a lot of practice with it now, कि how to deal with situations where there are no good options. There is this less than perfect option and this less than perfect option, and so which set of less than perfect options or solutions are you going to go for? I think हमने as a nation बहुत सारी चीजें बहुत सही भी की हैं, but at the same time I think perhaps the rapid testing could have been a part of the solution. I will say this, and for a long time I kept एक letter आया था मुझे, being lab director of Chaktai lab, मुझे एक letter आया था from the NIH, National Institute of Health, and it was such a refreshing approach. I kept that letter on my desk for like 6 months, and the letter was addressed to all the labs that the NIH knew of. कि जी ये pandemic आया है, and हमें ज़रूरत है कि मुल्क में testing capacity बढ़ाई जाए, और हम आपको encourage करना चाहते हैं कि आप testing capacity बढ़ाएं, and let us know how we can help you. And so हमारे मुल्क में for a long time it has been not all of us against the problem. It has been public sector against private sector, and problem बीच की वहीं रह जाती है. So it was so refreshing to have that sentiment put in paper and sent to us and to other people. And of course, we were talking to other people, and we were doing capacity building across the spectrum, trying to help each and every player as much as we could. And so we did a great job as a nation building capacity to do the PCR test. Having said that, we also, if you remember early on, जब antibody test के devices आए थे, I cannot tell you how many people I mean, the list is probably in the hundreds. जिन्होंने मुझे कांटेक्ट किया from all corners of the world कि जी हमारे पास ये डिवाइस भी अवेलेबल है और ये डिवाइस भी अवेलेबल है. And when you're trying to solve a problem, when you find yourself in a hole, they say the first thing you should do is stop digging. And so I think वो जो एक mushrooming थी of the various devices that were coming through the door कि जी ये भी device है, ये भी device है, ये भी device है. In fact, the FDA initially in the US allowed a few devices, but then had to backtrack and rescind several of those authorizations because वो devices Amazon पे मिल रहे थे और they had no clinical significance and no reliability. But having said that, now a year into this thing, we do have rapid PCR options available, which are which combine the reliability of the PCR test with the time sensitivity that is required in a hospital emergency room, for example. So technology takes care of a lot of problems. I don't think there were any perfect solutions then. I don't think there are any perfect solutions now. Perhaps face this with the same set of information, somebody else might have made different choices. If you look at net हम कहाँ खड़े हैं, तो मेरे ख्याल से overall बहुत सारे मुल्कों से बहुत बेहतर मैनेज हो गया है. क्या different choices की जा सकती थी? Probably, but what अगर एक आप device पे test कर भी लेते हैं और वो positive आ जाता है, and you know we face this same problem, by the way, in hepatitis C, B and C. The reason we have an outbreak of hepatitis B and C in this country is primarily because जो blood donors की screening होती है वो उन devices पे होती है, and उसका false positive का तो मसला नहीं है, मसला है ही false negative का. जो false negative है जिसको actually है infection और वो उसका device negative बता देता है, वो जाके blood donate कराता है और फिर वो hepatitis B या C जो है वो फैलता चला जाता है from one person to the next. So इसके अंदर भी false positive भी problem है. आप you know you have nothing and you're sitting at home, और false negative भी problem है because अगर आपको infection है और अगर आपने device पे check कर लिया है और वो it's fine, and you know no test is perfect. PCR, a lot of it is dependent on the quality of the sample. So the PCR जिसकी हम बात करते हैं 65-70% sensitivity, that has nothing to do with the PCR test technology. It has everything to do with the sample. अगर COVID blood में जाता होता तो PCR would be 100% sensitive, जिस तरह hepatitis B या C का PCR है. So but devices are intrinsically less reliable than the PCR test. So policy level पे many times there were many decisions made that I don't particularly agree with, and many decisions were made which you know I can't really say कि ये बहुत अच्छा फैसला था, बहुत बुरा फैसला था. But अगर looking back on the whole अगर देखा जाए तो I think we as a nation we have done much better than many places. And उसके अंदर public sector का बहुत बड़ा रोल है, private sector का भी बहुत बड़ा रोल है, because you know for once हम लोग joint effort कर रहे थे against the problem rather than के आपस में लड़ाई कर रहे.
Very true. बिल्कुल आप सही कह रहे हैं. And I think इसी vein में अगर हम continue करें तो एक audience की तरफ से सवाल आया है, which is a very good segue from what you just said, कि for a change the public and private sector work together towards a common goal, and epidemiology is of course a huge science in its own. आपके opinion में based on what you have seen in the front line, आपके अपना data set आपको बता रहा है, आपका क्या ख्याल है कि अगले 2-3 साल what are the strategies in the healthcare area that the private sector and public sector institutions, healthcare institutions can play in making sure that we get over this hump? I assume COVID is here to stay. तो उसके साथ we just need to manage it better. तो आपके क्या तासुरात हैं, आपके क्या feedback है इसके लिए?
I think yes, COVID is here to stay. लेकिन COVID की जो the threat that COVID poses to our life as a society, I think that continues to decline with every wave, because you know again there's जितनी भी तारीफ की जाए कम है जिस स्पीड के साथ जितने लोगों की वैक्सीनेशन की गई है इस मुल्क में, it's unbelievable. I mean, अगर आज से एक साल पहले कोई हमें बताता कि by October 2021, you know, I don't know, 40 million, 45 million Pakistanis को वैक्सीन की कोई ना कोई डोज लग चुकी होगी, तो you know, it was a pipe dream, possible ही नहीं था. आज से 8 महीने पहले भी कोई कहता तो शायद possible नहीं था. But you know, they started and then they kept pushing it. And जब तक यहाँ तक कि उन्होंने सिम्स को ब्लॉक करने का भी जब तड़ी लगाई, तो उसके बाद से तो फिर full speed, you know. So kudos for knowing के कौन सा बटन दबाने से क्या होगा. But I really think that हमें अब इसको हमारी strategy, healthcare strategy cannot just be COVID centric anymore. We have huge problems. Hepatitis is a silent but a deadly problem, and it's a slow moving tornado that's headed our way. और अगर हमने उसका कुछ ना किया तो it'll be a big problem. And so that's part of the Sustainable Development Goals for 2030. That is something that needs to be addressed, you know, in the same spirit, the private and public sector together. And एक sector जो बीच में कई दफा mention नहीं होता, but it is equally important, is the charitable sector. You know, because उनका बहुत बड़ा role है. And you know, these foundations, you know, like your foundation also, it's a huge impact. And so all of us have to focus on these problems. And आज मेरे एक दोस्त हैं कराची में, he's a cardiologist, and he said that today in a matter of 6 hours we handled 20 or 26 heart attacks at NICVD. And even though it's a reference center, but this is not sustainable. What are we doing to prevent heart attacks? So I mean, एक दफा heart attack हो जाता है, फिर तो हो गया, फिर तो all of the resources that are needed are addressed, are focused on that management. But you know, an ounce of cure or an ounce of prevention is probably better than a pound of cure. So what are we doing about that? So healthcare is not something that can be done by the private sector alone, by the foundations or charitable sector alone, or by the government alone. And I think वो recognition आहिस्ता आहिस्ता आ रही है कि हमें सारों को मिलकर करना है. And अभी तक healthcare की जब हम बात करते हैं, we are talking about managing, you know, treatment. We need to also be talking about planning and prevention, and that's a huge aspect of it. I know that blood bank authorities ban rahi hain to, for example, try and limit the spread of hepatitis B and C. That's very important. But any one thing alone is not going to be enough. हमें एक holistic approach के साथ चलना पड़ेगा. उसके अंदर all of us have a role to play.
Very correct. And yes, Alhamdulillah, I think Fatima Muril has been one of the third sector not-for-profit players who's tried to play its role, both on the acceptance of COVID, building the requisite areas जहाँ पे COVID ward के लिए हमने section off किया और चलाया, as well as awareness and taking care of frontline staff as well. Any notable CSR activity Chughtai Lab की तरफ से in this pandemic that you'd like to highlight before we move on?
Yeah, so we have a presence and an involvement at Central Park Hospital. So that hospital is run, you know, along the lines of a teaching hospital. So वहाँ पे इसी तरह there are all categories of patients, and you know, 70 to 80% patients, maybe even more, are either, you know, not paying or paying very little. And so we've been not only involved with that, we've been actually enhanced our involvement in the hospital and tried to uplift its facilities. And then we've done a lot of off the radar CSR, which not directly linked with healthcare, but you know, whether it's ration distribution, whether it is our own foundation has done a lot of that work, but traditionally we've never spotlighted that because our sponsors don't feel like highlighting it, and so we don't. But we've I think about 20,000 families have received some sort of ration or ration payments from us over the last year or so, year and a half. And that process continues. And so.
Fantastic. Kudos to Chuktai Lab and the foundation as well. Let's move. Let's shift gears a little bit. एक constant struggle जो हम face करते हैं, and I'm sure you do as well, operating in the healthcare field in Pakistan, has been कि हर कोई नीम हकीम बन जाता है, and then of course जब लोग पढ़ लिख जाते हैं हमारी तरह, तो वो ये भी कहते हैं कि जी हम WebMD देखते हैं, ऑनलाइन रिसर्च कर लें तो हम अपने डॉक्टर बन जाते हैं. And undoubtedly, I assume Chuktai Lab has also, in fact, your front-end staff must have oftentimes been asked, अच्छा जी मेरी ये रिपोर्ट है जी, आप जरा बता दें मेरे में क्या बीमारी है, क्या खराबी है, इसको सही किस तरह कर सकते हैं. What's your thought? I think one of the things which we see that Chuktai Lab has done actually has been to open these OPD clinics, which has, I'm sure, become a very active part. But how have you balanced this prescriptive role, which technically should not be part of routine diagnostics per se? उसके बारे में थोड़ा सा बताइए.
ये एक side effect hai of the way healthcare delivery is structured in our country. I mean, agar aap US mein practice kar rahe hain, to the patient almost never sees the lab representative and almost never sees the pathologist. But kyunki wo disjointed care delivery hai, so the surgeon is in one silo or diagnostics is in one place and the go-between is the patient or the patient's attendant. तो इसलिए वो फिर interface आ जाता है. And what we have to do is we have to travel this fine line between trying to be helpful, but also making sure that we don't give any bad information. So, and it's many times it's an impossible balance. And so one thing that our standard answer is that आपने ये अपने डॉक्टर से डिस्कस करना. In fact, it's written on our reports also that all results must be interpreted by a physician in clinical context. But having said that, बहुत सारे patients ऐसे हैं, for example, diabetic patients, जो they're monitoring one or two things अपने diabetes का HbA1c वो monitor कर रहे हैं, वो हर 3 महीने बाद करते हैं. So and they in many cases truly they have researched their illness और वो जानना चाहते हैं कि ये क्या है. So it's not easy. We continue to put more content on our website to try and be a part of the solution. What I'm experimenting with now is to start including links to the relevant tests, relevant videos based on what tests you got done. So for example, अगर आपने diabetes के tests करवाए हैं या hepatitis के tests करवाए हैं, तो we have started experimenting के जो आपको email आती है उसके अंदर relevant video का link हो, ताकि so you can get your most frequently asked questions answered in that video. And at the end of the day, of course, the lab or the pathology service is not a replacement for the physician, because हम एक aspect से देख रहे हैं patient को और एक दफा देख रहे हैं patient को. They have to go back to their physician for a more holistic overview and assessment. The clinics are a small effort towards that, to try and provide everything under one roof, because आजकल we feel कि वो जो disjointed healthcare delivery system है वो खुद से ठीक नहीं होगा, करना पड़ेगा. So it's an effort towards that, but naturally we have a lot more lab patients than we do who are seeing doctors in those clinics. So we have to have a menu of options to educate patients. But it's
much needed, of course.
It's often not enough.
Of course, and probably never will be, but at least I think, mashallah, wo katra darya banta hai, and that's what we must focus on. And which leads us to our next question, which has come up in the chat box. And see, as you can see, ke mashallah, Chuktai healthcare has really moved up and come to the forefront with let's say even with the medical centers, mashallah, multiple medical centers coming in. What's next? What's the next 5 to 10 years looking like, without sharing anything overly sensitive? आप क्या guide कर सकते हैं? Because obviously people want to assimilate to your leadership. What would you say are the in the near future?
सालिम, I think आप भी जिस तरह अभी थोड़ी देर पहले हम नूर इंटरनेशनल यूनिवर्सिटी की बात कर रहे थे कि जो entrepreneurial organizations हैं, जो innovative organizations हैं, उनका manifesto is many times dictated by what is the need of the hour, what needs to be done, and so then you figure out कि इसको कैसे करना है. I mean, आपका जो menu है of offerings in the university, that's completely attuned to कि हमारे पाकिस्तान में किन चीज़ों की ज़रूरत है, कौन से talents की, कौन सी education की ज़रूरत है. Similarly, we don't wake up in the morning and say कि आज क्या दिल कर रहा है करने को. We really want to have our finger on the pulse of healthcare delivery and see कि हम और कौन सी problems solve कर सकते हैं या at least थोड़ी सी आसान कर सकते हैं, because nobody can solve all problems, but हम अपना हिस्सा कैसे डाल सकते हैं to kind of make things a little bit simpler, a little bit easier, a little bit more convenient. So for example, our home sampling service, it came out of that whole thought process. We used to get phone calls. This was 10 years ago. We used to get phone calls कि मैं अपना ड्राइवर भेज देता हूँ, तो आप प्लीज अपने बच्चे को कहें कि साथ आ जाए और आके मेरा सैंपल ले ले, मेरी मदर का सैंपल ले ले. So one day Dr. Chuktai says, well, why is this a favor? Why can't we just do it for everyone? So the first question was, should we do it for people who can't come to the lab? So no, let's just do it for everyone. How are we going to define कि कौन आ सकता है, कौन नहीं आ सकता? And then it was like, should it be paid or should it be free? It's like, there has to be no obstacle to using the service. So it's free. So, and lo and behold, 10 years later, it's quite busy, this service, and quite popular. और जब हम late होते हैं तो we find out very quickly from our patients and friends, आपका बंदा time पे नहीं आया. So it's all about solving problems and making things simpler. So for example, 2 years ago, we started offering some, but we don't want to do anything that we can't do at the same level of quality that we do our labs. So Chuktai Lab started in 1983. We didn't do our first X-ray till 2016. So it took us 33 years to build the capacity and confidence in our system and have the right person on board. Okay, now we can start doing a little bit of radiology. But then 2 years ago, we started radiology proper with CT scan, MRI. Now we're rolling that out into various parts of Lahore and various parts of the country. So the medical centers, some of them are going to convert into full-fledged diagnostic centers also, so that people don't have to come to Lahore for a good CT scan, and people who live in Johor town don't have to come to Gulberg for a CT scan, that sort of thing. So all of that is in the cards, but I think the driving force has to be कि कौन सी प्रॉब्लम सामने नजर आ रही है और अल्लाह ताला ने आपको क्या कैपेसिटी दी है उसको सॉल्व करने की, and you just keep going. So
fantastic, and inshallah more power to you. May you accomplish all the dreams that you're aspiring towards. And so this gives us an opportunity in the last 5 or 6 minutes. One of the reasons why we do these sessions is for our current students, for our prospective students, for our recent graduates. वो कहते हैं hindsight is 2020, and mashallah, where you are today, a successful businessman, a successful entrepreneur. थोड़ा सा आपके बारे में अगर हम बात कर सकें on some of the challenges that you faced along the way. Obviously, it's वो continuous versus continual improvement वाली बात होती है. Could you maybe spell out a little bit about some of the hardest decisions that you've had to make, and whatever you're comfortable sharing in terms of decisions that you've taken to get to where you are in your career today? What could be some of them?
I think कभी-कभार decisions मुश्किल नहीं होते, लेकिन situations कभी-कभार मुश्किल होती हैं. For example, all बाहर जाने का शौक aside, it's not simple कि आप यहाँ पे घर पे बैठे हुए हैं, मेडिकल कॉलेज भी घर बैठे कर लिया है और आप यहाँ बैठे-बैठे आप स्पेशलिस्ट भी बन सकते हैं और आपको कहा जाए कि नहीं, go where nobody knows you और वहाँ जाके जीरो से शुरू करो, USMLE दो और फिर ये करो, अप्लाई करो रेजिडेंसी के लिए. So that's a daunting task. But मेरे ख्याल से जब आप मुश्किल काम करते हैं, कई बहुत मैंने देखा बहुत frequently जो success है ना, it is on the other side of something very difficult. So अगर आसान रास्ता लेते जाएंगे तो probably जो success है वो उतनी ही होगी. तो कई दफा थोड़ी सी मेहनत करनी पड़ती है, थोड़ा सा रगड़ा लगना पड़ता है, जरूरी होता है वो. उसके बाद फिर आपको वो, और शायद फिर आप अप्रिशिएट भी ज्यादा करते हैं जहाँ पे आप पहुँचते हैं. तो अगर कोविड की एग्जांपल ले लें तो द फर्स्ट 3 months ऑफ कोविड, आई मीन बहुत दिन मैं घर बहुत लेट जाता था कि बच्चे सो चुके हों, और सुबह उनके उठने से पहले आ जाता था, बिकॉज आई डिडंट वांट कि मैं अपनी फैमिली को, अपने बच्चों को एक्सपोज करूं. बट यू नो इट्स नॉट जस्ट मी, बहुत सारे डॉक्टर्स ऐसे कर रहे थे. सो लेकिन वो मेहनत की, और खुद की तो किसी और ने की. आई मीन यू हैव टू लीड बाय एग्जांपल. तो अगर आप खुद उतना एफर्ट करेंगे तो फिर कोई आपके पीछे उतनी एफर्ट करेगा. अपने टीम का ख्याल रखेंगे तो वो भी आपके मिशन का ख्याल रखेंगे. एंड देन 7 साल आप जाके अमेरिका जाके इतनी मेहनत कर लें और फिर वहाँ जाए कि यार वैसे तो मैंने वापस ही जाना था, तो सारी मेहनत कर ली, सब कुछ कर लिया, अब आपके पास जॉब ऑफर भी है, आप कहेंगे नहीं यार छोड़ के वापस चलते हैं. तो देन यू आर लाइक ठीक है. सो दैट्स आल्सो अ चैलेंज जो हर शख्स प्रॉब्ली उस पॉइंट पे आके शायद वो फैसला नहीं करता इमीडिएटली. But I'm happy that I made that decision. जिस दिन मेरी फेलोशिप खत्म हुई उसके 13 days later I was in Lahore. So it's been good. So कई दफा मुश्किल फैसले के थ्रू गुजर के अल्लाह ताला ने अच्छा रिवॉर्ड रखा होता है.
Well said. And वही बात के हर किसी की स्टोरी फर्क होती है, और आप सोचते हैं कि जी कितनी you never sometimes think about उस बंदे की particular situation and circumstances क्या हैं to make him or her arrive at what you see today as a final product. And again, we just have a few minutes left. Again, hindsight is 2020. Would you, looking back at where you are today, looking back, is there anything that you would choose to do differently, either career-wise, professionally, personally, anything that comes to mind? Not to say regrets, I think, but just choose to do things differently, or would it be all the same?
I think I would probably want to be a nicer person. I think जब आप मेरे ख्याल से जब मेरी बेटी पैदा हुई तो उसके बाद से I think I became a softer person, and I think it had a massive impact on the way I deal with people. But so शायद अगर वो lessons इंसान पहले सीख ले जिंदगी में कि आपको किसी के साथ, not that I was a rude person but I think I was really harsh sometimes with my own team, and I think at some point things got better. I became a different person, I think a better person hopefully. Became more patient and more understanding. कि हर शख्स, like you said, हर शख्स अपनी battle लड़ रहा है और हर शख्स अपने circumstances से गुजर रहा है. So you have to be a little bit more patient, more accommodating. So yeah, I think I would have been, if I could go back and change one thing, I'd probably be a little bit more patient, a little bit nicer with the people who work with me. But I think that has been the case for the last many years now. So जब मैं शुरू में पाकिस्तान वापस आया, तो that's when I really had to. That's what those 3 or 4 years I really wish I could go back and change. But
thank you, and again, thank you for sharing, and thank you for opening up to us. I think the human part of your life is a very, very real one, and for people to associate with you, and again to try and pick up your attributes, inshallah, as they pursue their careers. And so our last question, I know we're at time, but of course, given prospective students and graduates who are coming out of a medical lab technology program with an undergraduate degree, any tips, like let's say top 3 tips, agar aap unko dein, again looking back at your career, and what you would give them as words of wisdom before we call it a night for today, what would you say?
I think what I would tell them is what I tell anybody graduating from any university, कि आपका skill set is the starting point. आपका attitude is what will get you over the top. अगर आपका attitude curiosity वाला है, honesty वाला है, ethical काम करने वाला है, responsibility लेने वाला है, contribute करने वाला है towards the larger problem, so you will go a long way. कोई आपका रास्ता नहीं रोक सकता. I mean, there are people in this organization, my organization, and there are people in this city, identical qualification, identical degrees from identical universities, sometimes same university, and एक की trajectory ये है और एक की trajectory नहीं है वो. What is the difference? It's the attitude. So अगर आपका attitude positive है, अगर आप सीखने आए हैं, और अगर आप अपने आप को improve करना चाह रहे हैं, self renewal में believe करते हैं, तो then anything is possible. और अगर आप समझते हैं कि अब आपने डिग्री हासिल कर ली है, अब आपको हर महीने एक चेक मिल जाना चाहिए और आपके इतने टाइम के इतने पैसे हैं एंड यहाँ पर बात ख़त्म हो गई है, तो यस वो होता रहेगा और शायद वो आहिस्ता आहिस्ता कुछ बढ़ता भी चला जाए, बट यू विल नेवर हैव द करियर दैट यू कुड हैव हैड अगर आपका एटीट्यूड रिस्पॉन्सिबिलिटी लेने वाला हो, एथिकल काम करने वाला हो, ऑनेस्टी वाला हो, ओवरऑल ऑर्गेनाइजेशन के प्रॉब्लम को और मिशन को समझ के उसके साथ अलाइन करने वाला. अगर आपको वो एटीट्यूड है तो then the sky is the limit.
Thank you. I think Vaki, very good words of wisdom from somebody who's walked the walk and of course talked the talk, and continuous learning and continuous medical education. I think in this particular field is a huge part and parcel. And of course, there's no shortcuts. I think maintaining your ethical standpoint and moral standpoint high ground, so as to say, will definitely go a long way in serving, I think, our fresh graduates. And with that, my apologies for holding you for 2 minutes extra over time. लेकिन again, मैं आपका बहुत मशकूर हूँ, हम बहुत मशकूर हैं. I'd like to thank you for joining us today, our audience, our faculty, our current students, prospective students, alumni, those who are joining us online, the Wellbeing. We hope you enjoyed the session. Umar times and COVID has been my go-to person as well for personal advice and has been extremely helpful. So I can vouch that Umar has stuck to his ethical responsibility as well and has been a good friend. So Umar, thank you and really appreciate you doing this with us. And look forward to catching up again.
Thank you for having me. I had a lot of fun, and hopefully, students, the people watching will gain some insight. And let's do this again soon.
Inshallah, and we look forward to welcoming you on campus sometime soon. We'll issue a formal invitation and have you on campus physically as well.
Looking forward to it. Thank you.
Thank you very much. Okay, thank you. Khuda Hafiz. Assalamu alaikum.